Tell me, for those that are not well versed in the health and medical field, what the thyroid is responsible for.
Oh yeah, the responsible thyroid is responsible for your metabolism, for temperature regulation in your body. Also, it's related to how your heart rate palpitates. It controls the heart rate rhythm too, and so it does a lot of things. And it also is sort of the conductor. It works on some of the other hormones. It has a lot to do with turning on your adrenals, your cortisol. And cortisol kind of works with thyroid. We've kind of mentioned that before. So yeah, it has a big correlation. It helps with a lot of things in your body. And typical symptoms that people develop when they have hypothyroid is they have constipation, fatigue, dry skin. Their hair is thinning. Brittle nails. Just most common one is fatigue and constipation. And there's the most common type, believe it or not, of thyroid disorder, which is the where the thyroid is underactive. There's also hyperactive thyroid disorder where it's too active, but that's less common. But the most common type of hypothyroid is Hashimoto's. And Hashimoto's actually got its name from the person who discovered it. But what it is, it's your immune system mounting an inflammatory attack, or just basically attaching itself to the thyroid and causing inflammation and burning out the thyroid. Initially when it first attacks it, there may be symptoms of like hyperthyroid, but then where the thyroid is overactive, but eventually the thyroid will burn out and people will develop the opposite, which is low thyroid. And it actually affects over 30 million people in the United States. Unfortunately, it's not diagnosed as often as it should because most conventional doctors don't check thyroid antibodies. They only check TSH, which is a marker typically seen in the brain, that monitors thyroid levels in the blood. So if your thyroid levels are low, then the TSH is high, and vice versa. If the thyroid numbers are high, the brain or TSH, is low. So it's sort of inversely proportional, But so yeah, that